Good morning, everyone. Welcome to PT on Ice weekly show. I am Jessica Davis coming to you from Pittsburgh, Pennsylvania. I lead the Performing Arts Division as well as I do spine courses. So today I have my business partner, Carly Greenewald, and she's going to be my model today because what I wanted to go over was lateral arm pain with driving and reaching. So we talk a lot about in ICE about how to do that differential diagnosis, right? So we know that the neck can refer to the shoulder, or it could be a shoulder generated problem, or there could be multiple things that are contributing to this area, right? So just to review, it's important to do your good subjective exam and to get an idea. So something that you need to determine is that good functional asterisk, right? So we talk a lot about that in the ICE courses, yes? And it's important that you have the patient demonstrate and not just verbally tell you. So I used to, as a clinician, just listen to what my patients would say, and I would say, oh, they have pain with reaching. And what I would do was I would just have my own internal bias of what that was. But that was a mistake as a clinician because I didn't get enough information. You need to make sure that you reproduce their symptoms with respect to the irritability, right? So if it's a highly irritable patient, we don't want to necessarily poke the bear. But if it's a low irritability patient, we do want to poke that bear, or we're not going to get our patient better. So I'm going to tell you a funny story, just because I think this will help you guys learn from my mistakes as a clinician. So this was I don't even know how many years ago, but I had this patient who told me her number one issue was pain in her shoulder with driving, right? So I thoroughly assessed her. I was able to reproduce her symptoms. I worked on her extensively because I determined that it was indeed coming from the neck. So we were working on cervical retraction because in my mind, I thought, well, when she's driving, what do people do when they drive? So I'm gonna have Carly, why don't you demonstrate what people would do typically with driving? And I'm gonna come from varied angles. Yep, exactly. So they do that forward type posturing and they're going to drive, right? Or they may have one arm. Who knows what they're doing, right? But I made those assumptions that that's what she was doing. So I worked on exercises to correct that. And she was saying, I feel really good in the clinic. The moment I get into my car, I feel it again. So we were problem solving, and it is cold in Pittsburgh at times, yes, and the snow. So I remember it was winter, and of course the clinic is busy, but I will say that's no excuse. I need to get my butt outside and check what's happening in her car. So I have to admit it took me a couple weeks, which was bad as a clinician. I went out to her car, and what happened was she had her headrest. She had just bought this car, so it wasn't that old, but for whatever reason, the headrest had been installed in a the angle was, she was literally held her head, I'm gonna have you demonstrate. The headrest was pushing her head completely forward, and then she would look up from there. So every time I had her try to do the chin tuck, there was physically no way for her to do a chin tuck because she was completely in a cervical flexion type posturing. So it was terrible. All I did was correct that headrest, and my patient said, you know what, I'm better. So that was a mistake. It was a huge mistake. I'm embarrassed to admit it, but learn from me. Go out to the car. If that's their issue, you need to see it in real life. You need to determine what's happening. But what I really wanted to emphasize was some techniques that I've learned over time, especially from Tim Fira, and I'm going to give him 100% credit because he taught us these. But I want to share with you some of these techniques that are very functional, that it can help a patient learn, because what happens is typically they're going to have that pain. When you observe them doing the overhead reach or with driving, they're going to be doing that cervical type posturing, right? So patients have a difficult time understanding how to get out of that or how that may pertain. So I'm going to put this camera up here so you guys can see. Hopefully this works for me. Oh, I can't turn my phone while recording. Well, that might mess up my game plan here. Let's see. Sorry about that. Hopefully this works. Okay, perfect. All right. So go ahead and lay down, Carly. Okay, so what you want to do, we talk a lot about in our ICE courses, mobilization and getting a sense of how the neck is moving, right? But What patients need to learn too is that active movement. They need to learn and understand how to get into that movement. So often they're going to have a little bit of an extension moment, and they may even rotate one way or the other. So when you're doing your assessment, you need to determine what exactly they're having difficulty with and what exactly is provoking their exact symptoms. You need to know that because that's the only way you're going to truly correct their issue. So what I'm going to do is I'm going to use, as we talk about in ice, that lateral border. I typically with this technique will use my index finger for this method. So I'm going to use my index finger. I'm going to find whatever segment I've already determined is the provoker, let's say, or the area where the patient's having difficulty. And I'm going to come up on that articular pillar, and I'm going to do a little bit of a distraction and a little rotation in the opposite direction. And my opposite hand is going to be on the superior aspect of her head, just guiding the movement, right? So I'm going to do a little bit of a distraction, and I'm going to just guide Carly. Carly, I want you to just go into this motion. So I'm just guiding her into a little bit of cervical flexion and rotation. I may just want to do an isolated cervical flexion moment. Again, it's whatever I determine that I want to achieve, right, with my patient. So first is teaching the patient the movement, right? So I'm just going to say, I want you to go, just move with me. Good. So I'll guide her, and then I'm going to tell her, go with me. I want you now to go into that movement. Move with me. Move with me. Move with me. So I'm guiding the motion, but now she needs to understand how to do it herself. So what I'm going to do is provide a little distraction. I'm going to say, go ahead now, go into that motion. And what I'm doing with my hand, this hand, is I'm giving a little bit of resistance so she has that sensation of what to push into, right? So go ahead, Carly. Now go, 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 go. Good. So Tim talks about X minus 1, so I'm going to give her some resistance, but I still want the patient to achieve. I do not want to provide so much resistance that the patient can't achieve the motion. So that's all fine and well, right? So now the patient's understood how to do a little bit of flexion, cervical flexion, right? Well, I need to make it functional because the patient clearly told me that she has pain, let's say, for example, with reaching. So I need to find out, and hopefully with my subjective exam, I've determined how much weight, right? So if she says, for example, it hurts when I have more than 4 pounds, this is a 4-pound weight, I'm going to have her hold that 4-pound weight while I do the motion to make it functional. Now, she is laying down, so it's not fully functional yet, but I'm breaking the tasks down so that the patient achieves and has an understanding of what I want. So go ahead and grab this weight. So now she's in reaching, forward reaching, and I can work again on having her understand, go ahead and move with me. Good. Now, Carly, do that yourself. So again, I would break down the task. So we're working on that. Supine. So gravity isn't a factor here yet. So now we're going to take it into making that movement more complicated, and we're going to go into a seated position so she has to deal with gravity. So go ahead, Carly. I'm going to move this camera again. Okay, hopefully you guys can see me here. Yeah, good. Okay, so now gravity's a factor here. So gravity is going to change everything, and when it changes everything, I may need to play with my determination of what's provoking her symptoms. Okay, so I'm going to have Carly go ahead and take that weight, and I want you to reach. And if she says, yes, that's my pain, bring that weight down. What I'm going to do, Carly, I'm going to have you turn around so that they can see what I'm doing with your neck.
You want me facing this way?
Yeah. Okay, so what she's going to do, bring that down. I need to, as a clinician, understand, do I need to do a little bit of a distraction of the neck? Do I need to do a little bit of a lateral glide? Do I need to do a little bit of something, a combination of those two? What releases or improves her symptoms, if anything, right? So I want to show you an example. Okay, and this isn't good body mechanics, but I'm trying to show you as well. Okay, so Carly, what I want you to do, I'm just going to give you, I'm going to come up at the base of her neck, and I'm just going to do a little bit of a distraction. Go ahead and lift that weight. And what I would say to my patient, do you still have symptoms? And if she says, I do, then relax. I'm going to try to determine something else. I could generate a little more force. I could play with it to make sure that that isn't what I want to do. But if, let's say, for example, if it did relieve her symptoms, Then I'm going to do that for treatment. I would have her do the distraction manually, and I would have you lift and down and lift and down. All fine and well, but now I need to do a home exercise program, so I need to get creative. So maybe I have her take a towel, in this case I have a TheraBand, and I would have her use her opposite hand to do a distraction, and then I would have her do shoulder flexion as a home exercise program, right? Why not? You can get creative. Okay, relax. So let's say that didn't make any change, and what I need to do is I come up here and I do a little bit of a mulligan type technique with a side glide with arm movement, right? So I would come over and I would play around with whatever region I may suspect and go through each region of the cervical spine to see if I'm able to alleviate that. So I can come up here and I would do a lateral glide. I'm taking my thumb over thumb and gliding laterally. And I would have her do her shoulder motions. And I would say, Carly, does that change it?
Yes.
Okay, so she feels better. So that's relieving her symptoms. So I would first of all start this as treatment, yes? But then I need to teach her how to do it at home. So she takes her hand. She's going to do a self-lateral glide. And I'm going to educate her to make sure she's not combining that with rotation. She's keeping a neutral spine, and then go ahead and do that. So that could be something that she would use for home, right? Very good. Okay, so let's say that didn't really do anything. What we need is more of an active chin tuck, because what she's doing is she's doing this motion, right? So she's compressing there. So what I would do is I'm going to come over here, and I'm going to say, actually move around the other so they can see. So here, pretend she's supine. It's the same technique I was talking about before. I'm going to guide her now in a seated position into a little bit of a chin tuck. And relax, go, and relax, go, and relax. Now I can get a little bit better of a positioning here and guide her this way with my hand here across her arm, and then I can guide her that way, right? And I have a little more control of her in this position, but again, whatever works, just make sure that you're not educating something faulty, a faulty movement pattern, right? So let's say that gives her some relief, so go ahead and go with me. Good. I'm now going to have her move with me. Move with me, Carly. Good. Move. Good. Move. Okay, now I'm going to give her some resistance, so go, Carly. Go, 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 go. Good. Go, 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 go. And what I'm doing with my body here, which you may not be able to see, is I am blocking her so that we're able to isolate that it's happening from the cervical spine. So I'm going to spend some time making sure she has an understanding of that motion independently. Then I need to make it functionally. So go ahead and lift that arm, and we're going to work on the same thing. Move with me. Good. Move with me. Now, go, Carly. Go, 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 go. And all the while she's saying, I don't have pain, right? She's feeling that that's improving her symptoms. Now, you can also tailor this to driving. So you can use a ball. Hold on to the ball. You can barely see Carly. There you go. It's a little bit of a big ball. Okay, so same thing. I'm going to play around with this, and she can use the ball as a steering wheel, right? So I want to know when I'm evaluating her, does she drive just one arm, or is she a two-arm driver? Where on the steering wheel is her arm? That's the symptomatic arm. And what's happening with her neck? Because I've gone to the car and I've assessed what's happening functionally in that. So then I'm going to have her use the ball as a steering wheel, and again I'm going to play, do I need to incorporate a little distraction? Do I need to do a lateral glide? Do I need to do a little bit of an active chin tuck, right? Do I need to do a chin tuck with rotation? Do I need to do a chin tuck with rotation with distraction? Whatever you find, you then teach the patient how to do it themselves. So let's say, for example, we need to discover that it's a little bit of a distraction when she's driving. Now play with the wheel, right? So that helps her. So I can teach her to do her own traction and move the wheel, right? If it's good, if it's a lateral glide, that alleviates her symptoms. Home exercise program, self-lateral glide, and she's using the wheel, right? A ball at home to, in essence, drive. And then if it's an active chin tuck, we can put the TheraBand there, and she's doing a chin tuck, good, and then drive. And then of course, whatever that is, she can in the car, go ahead and take this away. She can in the car work on that chin tuck once she has an understanding as she's driving and see if that enables her to drive for longer distances. So in essence, there's a lot of variables here, but the thing I wanted to emphasize is when you do your evaluation, you need to take the time, and we emphasize this all the time in ICE, you need to take the time when you're doing your subjective and objective exam to figure out those subjective and functional asterisks and truly reproduce their symptoms so that you can generate a change. Okay, have a wonderful day, everyone. Thanks for watching and listening, and have a great day. Okay, bye-bye.